Thank you so much, Dean Tyndall, for those wonderful opening remarks and for really helping to set the stage for what's to come on today. We greatly appreciate you for being here. I have the pleasure of introducing our next highlights from NCPC from our Global Health Initiatives team. We have Ms. Nikita Dara. She is the Program Director of the Global Health Initiatives and Global Health Consortium. And she's actually coming to us live from Malawi now, as well as Mr. Bella Siangonya. He is the Assistant Director of the program. And we're so happy to have them both joining us. So Nikita and Bella, I will shift it over to you. Thank you.
Thank you so much, Mitchell. And yes, greetings from Malawi. I'm actually traveling back to the city center from to Blantyre, Malawi. So thank you so much for having us this, well, almost evening for me, but good morning to you all. Just because of the production standpoint, I think that I'll hand things over to Bella, but I did want to let you all know that we're here. We are leading the advancement and creation of health equity from all points of the world. We have an exciting community health worker program that has just begun. And in this visit, we're actually settling things out with all of the implementing partners here in country, working with the Ministry of Health through this PEPFAR-funded program through HRSA, which is the Health Resources Service Administration. We're so grateful that we have the opportunity to talk to you about this program. And Morehouse School of Medicine is also one of 4 partners that are the HBCU Global Health Consortium. And I'll turn it over to Bella now so that he can talk a little bit more about that. Thank you so much.
Okay, thank you so much, Nikita. Good morning, good afternoon, and good evening to everyone. My name is Bella Siangonya, and I'm the Associate Program Manager, Director rather, for the Morehouse School of Medicine Zambia Telemedicine Program. So as Nikita mentioned, Morehouse School of Medicine is part of the HBCU Global Health Consortium, which is currently funded by HRSA, and is comprised of 4 medical schools, namely Charles Drew University, Meharry, Howard University, and Morehouse. So Charles Drew, they focus primarily on working with adolescent girls and young women. The acronym is AGYW. Meharry focuses their efforts on pregnant women and new mothers, and Howard focuses on stable adults. And by stable, we mean individuals who are HIV positive, but they have their viral load suppression achieved. And Morehouse, we work with adults who have unstable viral load. So we work to suppress them and then hand them over to Howard University to manage them. So in this presentation, I'm going to talk about an innovative program that we've been implementing since June of last year. So in Zambia, there are many barriers to positive health outcomes for adult recipients of care. These are individuals who are HIV positive on treatment. And one of the major social determinants of health for this particular population are transportation costs, mainly because there are health facilities where these individuals have to access can be quite a distance. They have to use public transportation, and those who are fortunate to have their own vehicles, they can drive. But just given the high poverty rates in the country, not everyone can afford to pay for transportation. So most of the time they have to walk to the health facility. And what we notice is during the rainy season, which runs from November up to end of March, the rains can be quite heavy. So a lot of people, they stay away from accessing their care because they can't afford to pay for public transportation. And so that does have an impact on their health outcomes in terms of achieving viral load suppression, but also having their other health needs attended to. The other problem is Zambia has a very high HIV prevalence rate. As a result, there are a lot of people that go to the antiretroviral treatment clinics at the general hospitals. So the waiting times can be quite significant. We've had instances where clients in some of the facilities where we work spend up to 5 hours waiting to be seen. And this is someone who has arrived at the clinic at 5 in the morning. So you can imagine that does discourage people from keeping their appointments. The other challenge we have in terms of improving health outcomes for this population is the referral protocol to tertiary hospitals for advanced HIV treatment are very fragmented or lacking. So it's an area of work that the Morehouse School of Medicine has been working with the Ministry of Health within the capital city of Lusaka to improve on how we can refer clients from the general hospitals to the tertiary hospitals for advanced care. And when the COVID-19 pandemic started or arrived, the Ministry of Health moved by giving individuals multi-month dispensation. So individuals received medication for up to 3 to 6 months. And what this did is it prevented clients from having regular contact with their clinician to make sure that they're responding positively to their treatment and that other health issues are being addressed. So the solution that Morehouse, in collaboration with our funders, HRSA, came about with was to implement an innovative hub and spoke telemedicine model that will be integrated within primary care settings in the communities close to the residents, clients rather, sorry, and also linked to the general hospitals where they typically go to receive the care, and also linking it to another tertiary hospital called the University Teaching Hospital. So as I mentioned earlier, we use a hub and spoke model for our telemedicine program. So the University Teaching Hospital and the general hospitals, the acronym is UTH. These are the sites that are facilitated by a trained physician provider at this distant location. And this allows us to really decentralize specialized health services in the sense that individuals don't have to now physically have to go to the general hospital or the University Teaching Hospital to receive care. And then we manage our clients through the Ministry of Health's electronic medical records system called SmartCare. But we also have a telemedicine platform that we also use to manage. So right now we're working on integrating these two systems. It's been a challenge, but we believe we're making a great headway towards that. So the clients, they're based at the clinics right within their communities. These are community clinics that are managed by the Ministry of Health or other non-governmental organizations. And the sessions are facilitated by nurses and clinical officers. So when the client arrives, the nurse or the clinical officer, they do the basic assessments on the client, collect basic health information on the client, and then they connect them to the general hospital or the University Teaching Hospital to allow the client to have their telehealth session. So we just have a few pictures of the equipment that we use. So at the top, we have the telemedicine cart. This is based at the University Teaching Hospital and the general hospitals. And then we also have a portable medical case that contains various peripherals that the nurses and clinical officers use to assess the patient, such as the thermometers and blood pressure cuffs. So what are the results that we have achieved? So overall, we've had great success in terms of enrollment. The program has achieved a lot in terms of gaining buy-in from the Ministry of Health. And what we're now seeing are clients themselves approaching us to say, I want to participate in this program. I heard that the outcomes are great, specifically in the areas of patient turnaround time, which I'll present. So these graphs, they indicate the data in terms of how the program is performing. So the first one is the enrollment cascade, and we're looking at the month of October 2021 last year up to March of 2022. And this shows the enrollment cascade. So the first step is that the client has to be eligible to participate in the telemedicine program. We schedule them, and before their appointment, at least 48 hours, they receive a phone call and a text message to remind them that they have an appointment that's coming up. In terms of the services that we deliver through the telemedicine platform, they include treatment initiation. This is a TX-new, that's the indicator that we use to measure individuals who are initiating treatment. We have TPT, which is a preventative TB treatment. We have EAC, which is the enhanced adherence counseling to allow the clients to understand the requirements in terms of taking their medications to achieve the viral load suppression that we want to achieve. We also have, as of January this year, introduced mental health services. This is an area that was severely not met for our clients. So Morehouse School of Medicine has been able to introduce mental health services as part of HIV care for our clients. And the response has been overwhelming. The Ministry of Health, HRSA, and CDC, they're very pleased with how this program is performing in terms of integrating mental health services in primary care settings for HIV positive individuals. We also do abnormal vital sign reviews. This is something that wasn't being done comprehensively before the Morehouse School of Medicine came in, but we've worked with clinicians, not just through the telemedicine platform, but also in-person visits to train clinicians on how to collect the vital signs, interpret the results, and make clinical decisions out of those results. And we're also supporting clients with their viral load blood sample collection and processing through our partners at the university teaching hospitals and other partners in country. So the majority of our clients that come for telemedicine visits, they receive just one service at one visit. But now as clients learn that they can receive multiple visits, they're now presenting with other needs when they come for their visits. So the next segment, approximately 38% of our clients, as of the date of April, they're now receiving at least 2 services when they come for their telehealth visit. In terms of viral load tracking, it's an area that continues to be worked on. So we do a great job in collecting blood samples from all eligible clients, but just given the supply chain challenges that we face in country with our partners, not every client is able to have their blood sample tested in a timely manner. So that does impact how quickly we can report how our clients are responding to treatment and overall through the telemedicine program. So as of March of 2022, we have 93% of our clients who have received care through the telemedicine platform achieve viral load suppression, but our goal is to be at 95% in that regard. The other issue that I mentioned earlier is like the referrals to the university teaching hospital have been a challenge for the Ministry of Health. Prior to the Morehouse School of Medicine coming in, it was very difficult to track clients who have been referred to the university teaching hospital for advanced HIV care. And we have also learned from our clients that they hesitate to go to the university teaching hospital because they're afraid of getting lost and then having to ask a random person about where's the HIV treatment clinic, just because stigma around HIV continues to be high in Zambia. So a lot of clients, they choose not to go to this hospital in fear of getting lost. But our telemedicine platform has really allowed us to remove that barrier to care by allowing the clients to connect to their physician at the university teaching hospital remotely. So the program overall, we're doing well in terms of linking these clients to advanced HIV care. As of January up to April 14 of this year, we had 46 clients that were eligible for referral to UTH, and 43% were scheduled. 37 out of 43 clients managed to meet that appointment, but 6 needed to be rescheduled. So overall, it's a great performance that we continue to improve and work with the clients and physicians to identify more clients that can be referred for advanced care. So the main reasons for being referred for tertiary level care for HIV clients through our platform has mainly been second-line treatment failure. So this is an individual who's on a second-line treatment for HIV, but they're still not responding positively to that treatment. So they're referred to UTH for that advanced care. And then the other piece is the advanced HIV management. Again, these are individuals that are still not responding very well to treatment, and they need that more specialized care from internal doctors. The other major benefit that we have achieved with our telemedicine program has been reducing the turnaround time that clients spend at the facility. So the Ministry of Health has a target of no more than 1 hour for a client to be seen at the clinic. But through our work in terms of improving our workflows at the facilities, we've made great strides in reducing the turnaround time. So for the main services that clients typically go to the hospital for, the turnaround time has been 45 minutes, 52 minutes, and 1 hour and 5 minutes for TPT, which is a TB preventative treatment, EAC, and treatment new initiation, respectively. But when you look at the telemedicine program, you'll see that the most that a client spends on average is 23 minutes at the enhanced adherence counseling session, just because those sessions take a while to administer. So this is one of the major benefits that our clients are seeing, that it doesn't take them a lot of time for them to be seen by the telemedicine, through the telemedicine portal. So overall, we continue to record great success with our program. Our clients are reporting that they're happy with the platform, and the Ministry of Health has been reaching out to us to expand the scope of our work beyond HIV, but to allow other services to be provided through the telemedicine platform that we have implemented, such as maternal health and child health as well. But the good thing now, as we have established ourselves, we're also collaborating with the other 4 schools to allow them to use our platform to see clients that come for their services. And this concludes our presentation about the Morehouse School of Medicine telemedicine program. Thank you.